right, welcome back, everybody. 20 minutes past the hour, and the United States this morning is taking precautionary measures when it comes to a deadly Ebola outbreak, one that many global health experts warn could be underreported right now. So the CDC is now banning non-U.S. passport holders from entering the country if they have been to Uganda, the Democratic Republic of Congo, or South Sudan. So far, more than 130 people have died, with at least 500 suspected cases being monitored, including an American doctor living in the Congo. U.S. health officials say the risk to Americans is low right now, but there's no cure or vaccine for Ebola, and it is highly contagious. Joining me now, I have public health senior contributor for Forbes, Dr. Omer Awan. Doctor, it's always good to have you. Let me just start with the fact that the World Health Organization just declared this a global health emergency. What's the likelihood this reaches the United States?
Good morning, Marquis. Well, the risk to the public health in America and the people here is obviously very low because we don't have cases here, but that's not to say that there can't be imported cases. Now, there are 7 Americans that have now been exposed. One has tested positive, one is showing symptoms. So certainly there's always a chance. We've had previous outbreaks before in America, especially the 2014 and 2016 outbreak. But I would say the risk is very low, but not impossible, right? The risk is low, but not zero. So we need to be vigilant and be able to control this and contain this as well as possible. And that's what the focus should be going forward.
And this outbreak does involve a rare strain of Ebola. Tell us what more you know about it, and is it different from the Ebola outbreak that we remember from 2014?
Yes, it absolutely is, Marquis. So this is the Bundi-Bujo strain. It's a rare strain. It's different than the more common Zaire strain that we're more familiar with in previous outbreaks. And the reason why this strain is so important is because this strain doesn't have effective therapies that can help improve symptoms, whereas the other strain, the Zaire strain, did. It had, if you remember, monoclonal antibodies that could help mitigate symptoms. And the other aspect of this is there's no approved vaccine that's effective for, decreasing the spread of this virus, which is a key public health feature that helps control and contain outbreaks. The other Zaire strain did have 2 vaccines that were available that helped control the disease. So these two facts are going to make this very challenging to contain the outbreak. So very important to watch.
So with no vaccine, what does that mean for people who become infected and what their treatment plan looks like?
Well, treatment is now containment. That's essentially what happens when you don't have a vaccine. So that means isolation, taking people to biocontainment units, contact tracing, and supportive therapy. So, if you feel sick, getting to the hospital, getting oxygen if you have difficulty breathing, getting IV fluids. That's really important in this virus because, people typically have vomiting, diarrhea. They're not able to control their blood pressures. And that's actually why a lot of people die, because they're not able to control their blood pressure. So getting IV fluids at a hospital is critical when dealing with this particular virus.
Yeah, so a rare strain of this. You were on with me just last week talking about a rare strain of hantavirus. I mean, what's happening? Is this all just happenstance?
Well, I'm afraid that there's more zoonotic infections that are occurring. What I mean by zoonotic infections is an infection that travels from an animal to a human being. And we're starting to see more and more of this because of things like deforestation, climate change, agricultural changes, increase exposure and interactions between animals and humans. And this has been a trend, for really the last decade and multiple decades. So we just have to be on the lookout, be as vigilant as possible, and try to, control these as much as possible. This is why having a strong public health infrastructure is so critical when fighting these diseases.
Yeah. I think a lot of people rest easy right now when they hear it's a low-risk scenario in terms of our exposure here in the United States. But what about in less than a month? We have the World Cup coming up. You have people from all over the world who will be coming to the United States and the Dallas-Fort Worth area. Should we be worried about that then?
I would say, Marquis, the risk is still very low, but with that said, we have to be careful. The World Cup is an avenue and a platform where people from multiple different countries are coming here, and it honestly just takes one mutation, one virus to cause problem and to cause havoc. So we have to be on top of this. We have to be proactive as opposed to being reactionary when we consider public health issues and public health emergencies. And that means investing in public health infrastructure. surveillance, screening, detection, vaccines. All these things are critical if we want to move the needle in keeping Americans safe and less vulnerable to these infectious diseases.
Dr. Awan, another thing I wanted to ask you about, I know some health officials are blaming the Trump administration in part for this, just because, of pulling out of the World Health Organization, pulling funding to foreign aid. What's your assessment on that, and what would American dollars be doing in this case and situation?
Well, I believe that our global health infrastructure has weakened because we haven't invested in vaccines through the NIH, because we've, laid off many critical CDC workers that specially control outbreaks. This does not help our cause in protecting public health and global health for that matter. We've withdrawn from the World Health Organization. We've decreased hundreds of millions of dollars in USAID that help contain these very outbreaks that are occurring in Africa. The best way to help Americans and keep Americans safe is to control outbreaks at their root cause, which would be in Africa. So I am afraid and I'm concerned that our global health infrastructure is weakening. Viruses themselves don't create emergencies. Yes, they create outbreaks, but it's the public health response that create emergencies. And this is what's really at stake here with the changes that we've seen at the federal government.
Well, hopefully, we don't see cases here and it stays contained to what we know so far. But we're going to continue to monitor it quite closely, as I know you are as well. Dr. Omer Awan, always a pleasure to have you, sir. Thank you for your expertise.
Thanks for having me, Marquis.
We'll see you again soon.